Now to matters health, where the county government of Nyeri has stopped payment of salaries to 59 out of 62 doctors on strike in the Devolved unit, pending the dismissal for what the county terms as absconding of duty. Nyeri Governor Mutahi Kahiga, while issuing the doctors with an ultimatum to return to work, has also begun the process of dismissing them from service, as hospitals in Nyeri run at nearly half capacity following the disruption of services. Joyce Sitati with that report.
The Nyeri County Referral Hospital remains deserted as patients shy away from accessing services at the institution that is the major health facility due to the ongoing doctor strike. At the facility, empty wards and waiting bays have become the order of the day. Tales of some patients receiving and others not receiving services at the facility owing to the ongoing strike are not new.
Kosa daktari, lakini tumetibiwa, tukapewa tukaambiwa tuende huko kwa x-ray, tukapigwa pisha, na tukipigwa pisha tukarudisha kwa daktari, halafu tukaambiwa turudi, daktari mgomo ukiisha turudi.
For this reason that the Nyeri County government has stopped the payment of salaries to 59 out of 62 striking doctors in the county, with County Governor Mutahi Kahiga directing for their dismissal if they fail to return to work.
It is now left with no option but to take action against the doctors on strike, and I hereby instruct the Department of County Public Service Management and the County Treasury to immediately stop salary processing and payment to the affected doctors. Number 2, thereafter we shall move to the summary dismissal of all doctors who continue to be on strike.
According to the county chief, the Devolved unit has been struggling to offer services to its residents despite having 139 doctors on its payroll, even after 2 court decisions by the Employment and Labor Relations Court asked the medics to return to work immediately. Orders the medics have become defiant to.
County issued 62 show cause letters to doctors who are still on strike, and only 3 have responded, with the rest continuing to abscond from duty. The consequence of these actions has been untold suffering and death to the residents of the county of Nyeri, with a clear inhibition to the right of health.
Doubling as the chair of the Labour Committee in the Council of Governors, Kahiga maintains that forthwith collective bargaining agreements will be discussed at both levels of government to avoid a standoff that has seen counties that have honored the doctors' 2017 CBA.
The challenge we have now is that a CBA was signed in 2017 between amorphous people and the union, and purportedly that they brought in the counties under that CBA.
The clinical officers on their side maintain that there are issues including remuneration of intern clinical officers, career progression and payment of enhanced risk allowances must be addressed before they can go back to their duties. They accuse the Council of Governors for failing to implement the agreement already in place between the union and the national government, and they want the president to intervene.
The Council of Governors, they are only required to agree with the ministry. Na hiyo ndio wanakataa.
Kama rais hatachukua mamlaka na aweze kurekebisha sekta ya afya, basi sekta ya afya itaporomoka.
The president, however, seems to be holding steadily to his position in financial terms, especially on the ongoing doctor strike.
We must live within our means. We cannot spend money that we don't have.
The head of state says his government is in fact seeking to cut back on unnecessary expenditure and tighten its belt in the coming months. Reporting for Tandao News Outlook at 1, I'm Joy Sitati.